Hi, Terry Schoenfeld from UAB School of Medicine. In this video I'd like to discuss how to read and use the JAMA Rational Clinical Exam Series. The Rational Clinical Exam Series is a collection of systematic reviews assessing the accuracy of various elements of the history and physical examination. It's not a replacement though for physical diagnosis textbooks, and we'll see why when we look at an example of one of the articles. It's organized by conditions and not organ systems like a traditional physical diagnosis textbook. So for example, there's an article on does this patient have a pleural effusion? So the authors will not focus on how to do an entire lung exam, but will talk about elements of the history and physical examination that are useful and also not useful for diagnosing a pleural effusion. So elements of other components of the lung exam will be ignored in these articles, and they'll be only focused in this case on what's useful and not useful for a pleural effusion. There is a compendium of most of the published Rational Clinical Exam Series articles, and this is a picture of the textbook here, published by JAMA. It has a collection of all the originals plus updates of each of the articles. Now this was last published in 2009, so there have been a few Rational Clinical Exam Series articles published since then, which will obviously not be included in this print version. But if you subscribe to JAMA Evidence Online, you will get all the updates and all the articles up till the current time. So the information in the Rational Clinical Exam Series is ranked by the quality of evidence, and I wanted to demonstrate here the most commonly used levels of evidence. Some of the individual articles will have their own grading system, but this is the most commonly used, and we want to have as many articles as possible that are level 1 articles, which are independent and blinded comparisons of the physical exam sign or symptom with a criterion standard that lets you know the patient actually has that problem in a large number of consecutive patients. Level 2 evidence is similar to this, except it's in a small number of consecutive patients. Level 3 evidence is similar but in non-consecutive patients. And finally, 4 level evidence is non-independent comparisons of the sign or symptom in people who have or are suspected of having the target disorder. So we really want to have as many as possible studies based on level 1 or 2 evidence to support the physical exam maneuver or the historical element. As you'll see when you read these papers, there's a lot of lower level evidence in the physical exam. There's nothing the authors of the Rational Clinical Exam Series can really do about this. All systematic reviews do is review the literature that's out there. They can't fix problems in the underlying literature. So the nice thing about this series of articles is that really experts in physical exam and also systematic review have developed these articles, so you really don't need to think about the critical appraisal. The only thing you have to realize is that some of the articles on which the systematic review is based are limited. There's small numbers of articles and often small numbers of patients in those articles. These are systematic reviews, and when there are multiple studies that can be defined, combined, meta-analytic techniques are used. And meta-analysis are just statistical techniques for pooling study results. But one thing when you use meta-analysis, you have to beware of heterogeneity. And heterogeneity is differences among studies that are not due to chance alone. There's some systematic differences among studies, and this is always, well, it can be a bad thing in systematic review, but if nothing else, systematic review is often used to identify heterogeneity and try to explain it. It's beyond the scope of this video to talk about meta-analysis, but you will see reports of something called I-squared when studies are pooled. And I-squared is a measure of heterogeneity, and it's the percentage of variation across studies that is due to heterogeneity. We like this number to be as small as possible so that differences among studies are purely due to chance and not due to some systematic differences. So just keep that in mind. The smaller the number, the better for I-squared. And the big question in the Rational Clinical Exam Series is, have they become outdated? Many have been published over the last decade or so. More are continuing to be published. But the earlier ones, you have to wonder, are they outdated? Now, one caveat to this is not a burgeoning industry of physical exam research out there. So a lot of things, even though some of the studies are older, there's just not any newer studies done on the physical exam. So this is my opinion on how the Rational Clinical Exam Series articles could be used. Other people will find other different ways to use them. I think there are really two roles of the Rational Clinical Exam Series. One, it could be for teachers to decide what to teach based on good physical and history exam elements, or it could guide you in which elements to actually use once you've mastered all the techniques of history and the physical examination. So I think it could guide us in what we should teach or what we should at least use. Now, the nice thing is the authors of these series will point out 2 to 4 elements that are most useful, and they'll also point out which ones are not useful for any given clinical condition. So I think that's a nice thing, and what I recommend you do is that you remember and master these elements. Finally, there's a competitor, if you will, textbook out on evidence-based physical diagnosis by Stephen McGee. It gives selective evidence supporting the physical exam. It's organized by organ system, which is different than the Rational Clinical Exam Series. I think it's a little more comprehensive, has lots more elements of the physical exam than the Rational Clinical Exam Series does. It's more traditional textbook-like, and what I mean by this is it shows you a little bit more of how to do each of these exam maneuvers. Now, the Rational Clinical Exam Series, some articles do this also, but it's a little bit more comprehensive in McGee's book. I think it's more user-friendly, and it's more recently updated. This 3rd edition was published in 2012. So this is just a competitor. I'm not endorsing one over the other. I have no vested interest in either one, but it's something else that's out there that you should consider looking at if you're going to buy one of these textbooks. So let's look at an example of an article from the Rational Clinical Exam Series. I picked this one particularly out of does this patient have a pleural effusion? And traditionally how these are organized is that, I'm sorry, I clicked this too fast, is that they're clinical scenarios, and what the authors are going to do is resolve the clinical scenarios using literature. You get a nice systematic abstract reported here. And different articles often organize a little bit differently, so some will show you how to do physical exam maneuvers, others will spend more time on the search method used, etc. So they're organized a little bit differently, but many are similar. Now, one of the things in all systematic reviews is that the authors should give you a table showing you some information about the studies that were done. Here, the authors of this particular systematic review show you individual components that they're going to consider in reviewing to detecting a pleural effusion. They give you some information on how it's done. And really, the meat of the Rational Clinical Exam Series articles is this table of results. Now, I do want to go back 1 second because I was talking about the summarizing the articles that were included in the study, and this is a typical table from systematic review. So it will give you the author and the year a study was published. It will tell you who the participants were, and you can see there's some fairly small studies here. They will give you some sense of the presence of disease, and you can see here this is pretty variable from 40% of patients in this study having a pleural effusion down to 4% in this study. It will give you a sense of who the patients are, how patients were recruited, and we'll over here give you that level of evidence. So you can see in this particular case there's only one study which is of the highest level of evidence. Now, the results of the Rational Clinical Exam Series are in this nice table, and I think it's very useful and quick to get information from. It will be organized by the physical exam maneuver, and then under that will be individual articles which give the information. And you can see they organize their information by sensitivity, specificity, positive likelihood ratios, and negative likelihood ratios. And here you'll see pooling. So if there are multiple studies that can be combined, they'll do a pooled estimate using meta-analysis of the sensitivity, specificity, positive, and negative likelihood ratios. I encourage you to look at the pooled estimates when available. It's not a average of these, but a weighted pooling using statistical techniques. And again, focus on the I-squared. This is the percentage of variability across studies that's due to heterogeneity. You can see there's a lot of heterogeneity in these studies, and some people would argue we should never pool them if there's this much heterogeneity. That's an argument for another day, but keep that in mind. If things are pooled, look at the pooled results, look at the I-squareds, and just to help you understand the limitations of the data upon which the authors have to work and have to summarize. Finally, they will give you information on the limitations of their review, and then finally they'll finish up with resolving the clinical scenarios upon which the article was based. So I hope this helps you understand a little bit more about using the Rational Clinical Exam Series, their pros and cons, and I think it's a useful set of articles along with McGee's book to understand the limitations and also the usefulness of our history and physical examination.